Morning at NTV. World Tuberculosis and Leprosy Day will be commemorated, that is tomorrow, at Moroto District, that is Bomber Grounds, on the 24th of March. Yes, 2021. That's going to be from 8 a.m. stretching all the way to 2:30 p.m. You'll be hearing from health workers talk about the linkages between tuberculosis and the COVID-19 disease. They almost present the same symptoms. So a health worker at your local health facility might not be able to tell whether it is TB that you're suffering from or it is COVID-19 that you are grappling with. So we would like to know, what are the symptoms for you to be able to know what is happening to your health? We do have Dr. Raymond Biarohanga. Yes, he's also joined by Dr. Lydia Mungerera, now, with whom we are going to be having these conversations. A very good morning and thank you for joining us.
Good morning to you.
All right. Dr. Raymond Biarohanga is the Senior Technical Advisor at the Ministry of Health. And then you do have Lydia Mungerera. She is the ED, Mama's Club, Uganda, and also a commissioner at the Uganda AIDS Commission. All right.
Thank
good
you.
morning.
Good morning.
Good morning.
Let me start with you, Dr. Biarohanga. Let's talk about TB. It's not one of those diseases that are talked about regularly. And COVID-19 is here. Do you think conversations have been more on COVID-19 and not other diseases like TB?
Thank you very much, Romeo. Good morning, listeners and viewers out there. Yes, TB has not been talked about so much. And COVID is now on everybody's lips and all over the world. And for the simple reason, mainly COVID has affected economies of countries. And tuberculosis is one of the oldest diseases in the world. Now the biggest infectious disease in the world today, second to COVID. But because of COVID's rate of mortality, of death, has been so high, especially in the European countries and in the US, and TB has been eliminated more or less in the US and in Europe, and that's why it has remained a disease. One, they say it's the disease of the poor, disease of the congested communities, and therefore it has taken a lower stage. However, would like to inform the communities and the people out there that tuberculosis is now one of the biggest killer infectious diseases in the world. In Uganda specifically, it kills more than it infects more than 88,000 Ugandans every year. And the death is about 15 to 20,000 people annually.
You're telling me
in
we've
Uganda.
been losing between 20,000 people?
Yes, in Uganda.
On a yearly basis?
On an annual
You're
basis.
talking about COVID-19 affecting 40,867 people, vis-a-vis 334 people dying, but tuberculosis is killing more people, than COVID-19.
Yes. And to make even things worse, TB is curable.
Go ahead.
TB, when you are still a baby, has a vaccine, BCG. When you grow up and you get tuberculosis, you get medicines.
Indeed.
And you are cured. But the communities out there are dying. People living with HIV is taking half of what the people that have TB are dying of. So you can see that already it needs to be talked about. It needs to be brought to the top agenda of this country.
Indeed, and then NTV took the initiative to do so ahead of World TB and Leprosy Day, that is
Yes.
tomorrow.
Yes.
Dr. Lydia Mungerera, let's talk about the burden of tuberculosis in Uganda. Is it affected by the association with HIV?
Oh, yes.
Go ahead.
About 40% cases of TB are people who are living with HIV. And HIV actually makes the TB disease worse. And there are many other things, for example. There are many similar things. People who are living with HIV, there's a lot of stigma associated with HIV, the same as TB, the same way.
Yeah.
And people living with HIV, because their bodies are already immunocompromised.
Indeed.
So their bodies are weak. So when they have TB, TB is one of the biggest killers. Actually, I think 30% of TB infections, TB deaths due to TB infections are people who are living with HIV. So it is very high, very much similar. It's very much affected, and also the psychosocial issues that fall around HIV disease are the same psychosocial issues which surround tuberculosis. And the other thing is, of course, the people who have, there's a burden of care in households because of tuberculosis. The same people who are living with HIV, and because they tend to get TB, they also tend to get other diseases because their systems are immune systems are very low.
Now I'm looking at someone who has TB, HIV, and COVID-19. That is
Exactly.
a triple threat. What would be their chances of survival?
Very, very, very small chances of survival because already they're immunocompromised, their bodies are weak, and they have COVID and they have TB, and also their lung. That status of their lungs is not good. The lung function, the oxygen saturation in the lungs becomes very low, and really the prognosis is very poor.
Dr. Biaruhanga, we also do know that COVID-19 also presents with symptoms that are similar to COVID-19. Are our health workers equipped with the necessary equipment to actually determine that Romeo Busiku is having TB and not COVID-19?
We really appreciate the fact that actually COVID-19, first of all, came at the time when we are really improving our TB services. And we were screening very well. We were moving ahead to do contact tracing. And then COVID-19 comes in. And COVID-19 takes the same kind of route of management as tuberculosis in terms of making sure that every person who has COVID with a cough, a fever, is tested for COVID-19. But then immediately we've instilled into our health workers to make sure that they do both tests at the same time, both for COVID-19 and TB, to make sure we do not miss out on anybody with tuberculosis. Because many people have been stigmatized today as a result of, because of COVID presenting with the same signs and symptoms as TB. So many people have been stigmatized, and people have pulled back in terms of saying, if I go for a TB screening test, maybe they might find COVID in me, and they might tell me, to do 1, 2, 3 things. But we have encouraged, we've talked to our health workers. We've gone out to work with the community engagement system to make sure that let's educate our people to make sure that they do understand the COVID and tuberculosis signs and symptoms. But remember that COVID tends to be instant. It's like an emergency. People have a cough, people have fever, and fall down and fall sick, and they need to get into hospital. TB, people tend to move with this for a long time. But moving with it for a long time does not stop you from spreading it and infecting others. And that's why we have talked to our health workers to make sure that everybody who comes with a cough at the facility is screened for tuberculosis, but also screened for COVID-19. And to make things even more interesting and worse is that the COVID test is done on a gene expert. Recently, His Excellency, the President, was talking about the gene expert machine. We use it in tuberculosis. It's actually our first diagnostic tool in diagnosing TB. So the advantage we have is that now that we have about 280 machines around this country, we are taking advantage of saying that if we can use it for tuberculosis testing, we should also be able to use it once we have the supplies for COVID, and use it also as well for COVID-19.
So, Dr. Raymond Biaruhanga, according to the figures you were giving me, over 20,000 deaths owed to TB annually, and also over 80,000 cases of TB being registered on an annual basis.
In Uganda.
It more or less looks like a pandemic. And I was wondering why we are not calling it a pandemic. But then, let's talk about its spread.
Yes.
How is it acquired and spread, TB?
Tuberculosis is spread through the air. Once you have tuberculosis,
just like COVID.
Once you have tuberculosis and you cough, you talk, you smile, you will always spread it out to to your neighbor, to your family friend, to your neighbor. But more specifically, certain different populations tend to get it much faster. People living with HIV, children, diabetics, prisoners, people in congested communities. So you can see that actually tuberculosis it's slightly different from COVID in that once you touch different surfaces, it remains there. For tuberculosis, you must be close to someone. You must have an immune system that is deteriorating, that is coming down, that your chances are very high that you might get actually tuberculosis.
All right. Dr. Lydia Mungerera, let's talk about whether or not, as the ED mamas, the NGO and also the Commissioner, Uganda AIDS Commission, whether you've noted any challenges in accessing of TB treatment brought on by the imposition of the COVID-19 lockdown.
Oh, yes. During the COVID, especially the lockdown period, it was very difficult for people to move around, to access health centers, and to freely go to health center. So that was a problem for people who are accessing TB and TB treatment and also their HIV treatment. So there's been a big challenge, and that during that time, there are many people who actually missed out on their treatment, although they were being helped by networks of people living with HIV. And we really thank organizations like TASO and others, and our networks who went out there to make sure people get their treatment. There was a big challenge, and COVID actually brought a lot of issues, also psychosocial issues, also economic issues, and the fact that the nutrition of a person has to be good to be able to increase their immune system. The people were lacking food.
Indeed.
They were not working, and besides not working, of course, people didn't have where to get money from. So it did affect the outcome of TB. And also must realize that people now were crowded in their homes. You know that people during the day, fresh air, when people go out to work, everybody was at home. So that also affected it. And of course, there are many challenges that happened during COVID. People's pockets. People needed transport to get to the hospital, and they didn't have transport.
So could we say that the lack of access to treatment may have precipitated so many deaths as a result of TB?
True. That's true.
Just not alone death, even the increase in the number of TB cases.
Yes.
The number of HIV cases.
Yes, Raymond.
The number of... So as a result of the lockdown, and people not getting their treatment, but also people getting together and being congested. Children came back home. They went and stayed with their parents.
Exactly.
Other people came together into the community.
So chances are in a family of 12, if there is one with TB, he or she would infect the rest.
Infect about 3, actually infects about 10 in a year.
I hear you.
So that increases the rate of TB, and less screening. People are not getting their treatment, and that makes it even worse for the patients.
There have also been concerns that access to TB remains very, very expensive. What are you doing to change that?
We can say that as a result of government policy and as a result of our friends, tuberculosis treatment is free of charge.
Now.
In
every health center.
Diagnosis for tuberculosis, it is free. Treatment is free. It has been free. We've never charged for any treatment in any government facility or even in any private facility. So we do appreciate government efforts in making sure that from national level hospital up to health center 3 at the community. In some places in Karamoja, we haven't gone up to health center 2s that are giving treatment for TB free of charge.
Yes. But we also do know, according to the statistics I have here, that only 2% of the reported TB cases are from private. From profit health care centers, yet 58% are from your health centers as well.
Yes. And that is a bit of a skew because many of our public facilities do actually have services to provide for screening, testing, and treatment. But now we are engaging the private facilities, and the main reason why we're engaging the private facilities is because it's the first place that patients tend to go to with a cough.
The private health.
The private facilities, the drug shops out there in the communities. Patients tend to go there with a cough, and they cough and they get Septrin or they get some amoxil and go back home. And in due course, they are really causing a lot of disease, both to themselves and to the people at home. And that's why we are now having a deliberate policy to make sure we engage the private sector into TB management.
Let me also bring in the ED Mamas Club when we talk about behavioral change. Why is it that 2% of these TB cases are from private healthcare facilities, yet 58% of the individuals first go to them to seek help? Why is this so?
You see, the thing is that there's this culture and behavior that, that people have to build more trust in government health facilities. They think because they went there yesterday...
So it is a trust issue?
It's a trust. There's a little bit of a trust issue, but there's also an issue that's saying that probably I'll get no... and people, the burden of care of hospitals now, people find it easier that let me just quickly go to my private clinic, I'll probably be attended faster. But also know very well that there's a lot of stigma attached to tuberculosis as well as HIV. It's the same thing. So people think that if I go to the private health center, people won't see me. you know, and I can hide, and you know, there'll be more confidentiality than seeing me in a public, because HIV and TB are both stigmatizing diseases.
Indeed.
So we have to work a lot. I think there needs to be a lot of work done.
So before I let you two go, let's talk about, let me have your views on what can be done to improve the treatment, access to treatment for TB. Let me start with you.
From the community angle,
Yes.
I think we need to have more people out there, grassroots soldiers, the civil society going out there and talking more to people. There needs to be more information out there. There needs to be a lot of issues regarding stigma and discrimination. We need counselors, more counselors. We need people to work with the networks of people who are living with HIV to actually do that.
I want to conclude by saying I am a man.
Indeed.
And today, men are the most at
Highly
risk
infected.
and are highly infected with tuberculosis.
Indeed.
We are approaching, we are leading, we are moving out, Lydia Mama's Club, Ministry of Health. We are going out to the community to make sure we engage more of the men.
Dr. Raymond Berohanga, Senior Technical Advisor with the Ministry of Health and also the ED Mamas Club. Thank you very much, Dr. Lydia Mungerera, for having made the time to come through. She's also a commissioner at the Uganda AIDS Commission. Many thanks for having made the time to speak to us.
Thank you very much.
Indeed. So the silent killer, TB, 80,000 cases on a yearly basis and also 20,000 deaths. Much, much more deadlier than COVID-19 as it is. Please, keep yourself safe. My name is Romy Busiko, David Louis Rubongoya and Morrison Rakakamba are already here.